Anneliese Dressel of the Health Hub Times Square in Ballincollig joining us this afternoon. Good afternoon, Anneliese.
Good afternoon, Patricia.
And straight into questions. Mary says, hi, question for Anneliese, please. I've just been diagnosed with diverticulitis. I'll be put on an antibiotic. I'm wondering what supplements Anneliese would recommend to help prevent another flare-up, and what foods help with it and what to avoid. And by all accounts, it is quite a painful condition.
Yeah, so there's diverticulosis, which is the condition, and then diverticulitis is where you've got the infection. So diverticulosis is where little pouches blow out in the smooth muscle of the bowel. And what can happen is food particles and undigested food, other bits can get stuck in there and can get infected, and then that is exceptionally painful, and you definitely need an antibiotic to clear it. So after the antibiotic, I would recommend a good quality probiotic. Try and get one with a good variety of different strains in there. So you've got like Udo's 8 is a very commonly available one. BioCult is another lovely one. And we have one here that I really like, which is by Nature's Plus. It's called Immune Microbiome. So it's a probiotic with specifically immune boosting and managing bacteria in there as well. So that's definitely one to take after any antibiotic. And then really prevention is key. So of course it's about having a nice well-formed daily bowel movement, no straining, no pushing. The advice used to be that you would avoid seeds, but I think actually all of those are fine. If you're worried about them, grind them up and just add them to your breakfast cereal ground up. So you could have ground linseeds and chia seeds and pumpkin seeds, and these are all great fibre and great to help you have a nicely well-formed bowel movement. The other thing that's very good as well is psyllium husk. It's what they call a soluble fibre, which means it kind of goes into a gel or a gloop, really, if you look at it when you mix it in with water. And that helps to ease the passage of a stool as well. So that's a great one. You can add it again into a smoothie or a yogurt or breakfast cereal in the morning. Just make sure you're taking plenty of fibre in your diet. That's really the key. We don't eat enough fibre really in the Western world at all. At least 50% of every meal that you should have should be vegetables or fruit for breakfast. So half your plate at all times should be coming from vegetables, and then everything whole grain. Avoid the white breads, white rice, white pasta that are minus fibre, and you should be fine.
Okay, hi Patricia, could you ask Anneliese, what's the best treatment for IBS with cramps and indigestion?
Okay, so that's the $1 million question, Patricia. So irritable bowel syndrome, really, in a way, the term sort of gets on my wick, because if you go to the doctor telling them your bowel is irritated and you've got symptoms of an irritated bowel like cramping or pain or bloating or wind or constipation or diarrhea, and they say, yes, you've got irritable bowel, it doesn't really tell you anything. So in my experience, the key is trying to find out what has caused it. It can happen as a result of taking medications, long-term antibiotic use, or non-steroidal anti-inflammatories like diphenhydramine or brufen damage the gut. It can come as a result of picking up a bout of food poisoning or a parasite when you're on holidays, so the gut bacteria are disrupted and that causes inflammation and irritation. And the third thing then, I think, is food intolerance is a very common one that I see. So you're eating foods that your immune system is looking at as invaders, and it's causing an inflammatory immune response in the gut. So getting to the root of it is key, but we do find a couple of supplements help very well. One of them is the GI Wellness by Nature's Plus. It comes as a powder or capsule, and that's great for a general gut healing supplement. Probiotics are very important as well. Again, the ones I mentioned earlier will work well. And then a digestive enzyme would be very important. This just helps you break your food down a little bit better, and it means that it takes the pressure off your own gut to do the work, and it means that less undigested food is reaching further down where it might be fermented or putrefied, causing irritation. So those would be general supplements that can help. Some people find that taking L-theanine and valerian, the ones that we normally recommend for anxiety, can help with the gut because they can be very good for helping calming. And if you're stressed, again, that's another reason that your gut might be all uptight. So if that's the reason, they're the supplements for that, L-theanine or valerian.
Hi, Patricia. Could you ask Anneliese about feeling sluggish after a long haul flight with a time difference?
So the best thing really is, unfortunately, we can only get on prescription here in Ireland, and that is melatonin, which is the sleep hormone. It's great for kind of resetting you when you're jet lagged. Actually, my personal favourite, Patricia, is just kind of trying to stay up as late as you can and having a few glasses of wine before you go to bed to knock yourself out so you get a good sleep. But the general sleep ones can help with that as well. So you've got your valerian. Irish Botanica do a lovely strong valerian, Peace and Calm it's called. Another great sleep support is the Nature's NHP, Natural Health Practice, Advanced Sleep Support. So that's a very good one for that. That you sleep with the curtains open is another small tip, because the natural light will help your system wake up naturally as well. So for the first few nights, sleep with your curtains open.
Okay, hi. Question for Anneliese. Ashwagandha, is it safe for a 16-year-old male to take?
It is. Generally, Patricia, we'd kind of recommend that anybody under the age of 18 sees a herbalist. But the truth of it is, 16-year-old is like a man in terms of his body size, certainly like an adult woman in terms of his body size. So just follow those same directions as you would on the back of the pack. Don't overdose. But it should be absolutely fine. It's a herb that's usually used to support people through times of stress. It's very good for people who suffer from stress-related anxiety. And what it does is it just helps to raise your tolerance levels, really, so that you can cope with situations better. So it kicks in about 4 weeks, and it's probably one of the most popular supplements we have at the moment.
Yeah, I've heard a lot of people singing its praises. My daughter is in her 20s, had a blood test showing she's glandular fever, lost her appetite, she's extremely tired. Is there anything that Anneliese would recommend she takes?
Yeah, now glandular fever actually is a one that can linger for a long time, and actually I think a lot of people that I would see, Patricia, that suffer from viral fatigue and chronic fatigue have had glandular fever in the not so distant past. So it is very important not to just support the energy pathways, but to support the immune system. So I would definitely recommend the Source of Life Gold just for a good immune boost. For a good energy boost. Because that all with a little bit of ginseng can help you get back on your feet and back into school or work, college quicker. But in terms of the immune system, this is where I'd really be careful to focus on, because you want your body to be able to get rid of that virus so that it's not lingering. So I would definitely recommend the olive leaf extract liquid, which is really, really good natural antiviral. And if you can get your hands on it, there is a supplement by Nutri Advanced. Generally, you need a practitioner to get this for you, but we do have it in the shop, and it's called Virese, Virese. But it's a particular kind of supplement that's very good to stimulate the virus-fighting side of your immune system. So I would often give that to people who are suffering from kind of post-viral fatigue. It's great if you still have shingles and you can't get rid of that last bit of the shingles virus. So any virus that's hard to kick, that Nutri Advanced Virese is a great one. And then make sure you're doing your vitamin C, your zinc and your vitamin D as well.
Well, maybe you've answered the question for Eileen. Her sister was diagnosed with shingles 9 months ago. She still has severe pain and soreness, and she's any of the ordinary medicine that was prescribed by the doctor. None of that seems to be working for her. Any suggestions?
Very difficult one, Patricia. So what's happened there is that the nerve endings have become inflamed by the virus, and they are now in a non-ending loop of inflammation. So you can get very lucky with this, and you can be unlucky. The natural remedy, the homeopathic remedy Hypericum, Hypericum, can be good for inflamed nerves. That might get it. It's not always the right thing, Patricia, but for some people it can help. Then you need to kind of follow an antiviral and anti-inflammatory approach. So the antiviral, again, that Virese is excellent, or the olive leaf extract. But then in terms of the anti-inflammatory, you might be looking at something like turmeric and boswellia extract. That can be very good. For some people, the extract of pepper called capsaicin, which is the really hot bit of chilies and peppers, that applied can sometimes relieve the symptoms. Now, I'm always worried about recommending it, Patricia, because God forbid you'd irritate it even more. But there has been some clinical studies on the use of it. So you could get that. You could make your own extract from chili. But the Pernaton Forte that I'd often recommend for sore muscles here in the shop, that has got that capsaicin extract in there. So that could be another one to try, but you'd rub that on directly.
Okay, listen, we're going to have to leave it there, and our apologies to people whose questions we haven't got to. We'll take a look and try and get to them next week. Anneliese, thank you for that.
Thanks, Patricia.
And thanks for joining us. That's Anneliese Dressel of the Health Hub Times Square in Ballincollig. Anneliese will go on her own website this afternoon. We'll put up as heard on the radio. That's the healthhubstore.com. And I know John Paul in the afternoon also puts up Anneliese's piece as a separate podcast. So you can get that wherever you get your podcasts from.